My suggestion would be going in with a chief complaint of you want to discuss your weight. Because what often happens is, and at least when I was a family physician, someone would come in because they have, I don't know, a bladder infection. And as my hand's on the door and I'm about to walk out, oh, by the way, can you give me phentermine for my weight? It's like that wasn't the purpose of their visit. They just want to piggyback it onto something else. And you can't really address it appropriately then. At the same time, I know that before I was an obesity medicine specialist, I was not really comfortable with addressing obesity with a patient because I was not trained on how to help someone lose weight. Most of what I do now, I did not learn in medical school and I did not learn in residency. I learned on my own when I started my own business. And, I left my job as a family physician and later became a Center for Medical Weight Loss. That's when I learned how to help people lose weight. So when you go in to see your physician, if they were anything like me, they weren't trained on how to help you lose weight. And as I said earlier, since insurance companies didn't pay for treatment of obesity, nobody really bothered doing it because it was, work that you weren't getting paid for. But if you do have that concern, go in with that being the chief complaint. Don't piggyback it on anything else because it'll get brushed under the rug because there just is inadequate time to deal with that. And then if your physician is not comfortable managing it, again, I just didn't know how to. I didn't know how to counsel. I was never taught how to do that. Then ask for a referral for someone who does specialize in medical weight loss. So that'd be my recommendation on how to start that conversation up. So in my office right now, we specialize in medical weight loss. We specialize in hormone balancing and we specialize in substance use disorders. So treatment of opiate use disorder, alcohol use disorder. So when my patients come in, I try to get a weight on everybody. And then I try to get their height and calculate what their BMI is. And then if their BMI is greater than 25. A BMI less than 25 is considered normal weight. Between 25 and 30 is considered overweight or pre-obese. Greater than 30 is considered obese. So if their BMI is above 25, then I might have a conversation, regardless of what they came in for, say, hey, just so you know, your BMI is da-da-da-da. That fits the category of da-da-da-da. We do specialize in medical weight loss. And so if you ever were interested in trying to lose weight in a healthy way, we'd be happy to partner with you and help you reach your goals. So I think I would approach it by letting them know what their BMI is, because not everyone's interested in wanting to lose weight. And if they didn't come to see me for their weight, they might care less. And so that's their choice. But at least I would try to let them know that this is a diagnosis. And then however they want to handle that would be up to them.